marks of inflammation, and you're utilizing everything in the area. So what's under my hand is the question that you're essentially answering. You know, if it's inflamed, what lives there? And that's kind of the key ingredient to really all
Static palpation.
all static palpation, regardless of whether it's extremity or anywhere else. So if it's sore here, I might think, okay, what lives there? Well, I've got brachioradialis, I've got the I'm on the thumb side, so I got the radius on that side as well. It's the common flexors. Maybe I'm dealing with one of those. Again, a situation where you just think about what lives there. It's certainly not tricep. It's definitely not, right? Because it doesn't live there, and it's the same in the spine. It's not T6 because I'm at T2. So it's the same thing. It's not rhomboids because I'm on the lateral side of the scapula, right? So it's just intelligence taking the anatomy and just sort of going, okay, is the heat or is the swelling, is the tenderness, is the sweating, is the bogginess, is it the distribution of my whole hand, 2 fingers, 1 pinpoint spot? And if so, what lives there? Oh, that's a transverse process, or which is close to a facet, or it's here. Oh wait, that's the rhomboids, or that's the trapezius or levator, right? So essentially listen to where the patient or where your information guides you on static palpation. But recall that this is about the hallmarks of inflammation. So when you're analyzing through through static palpation, you're going to use light touch, and you might even say this on your video. So for static palpation, before I invade the patient too much, I might just do a quick heat scan in the general area before disrupting it. And I'm looking for some of the hallmarks of inflammation, heat being one of those. But then I'm also going to look and see if there's any sort of redness or bogginess or sweating that I can observe. Now I'm going to get into touch. Mr. and Mrs. Patient, if you don't mind, I'm going to touch your contact areas. So I'm going to run my fingers down the transverse processes. I'm sort of feeling for any sort of evidence of swelling, tenderness. And please, Mr. Jones, let me know if you've got any sort of tenderness in any of these sort of areas. Now I'm feeling some of the musculature in the surrounding area, looking for spasm or any other sort of evidence of swelling. Go around the scapula, and you're only in the thorax, right? So,
correct.
Essentially, levator, trapezius, upper fibers, medial, iliocostalis, and that sort of thing. The paradorsals are deep to the rhomboids, especially in the middles. So you might say there's an intersection there, but really you're only getting rhomboids because they're on the exterior surface. You might get into the upper parts of the latissimus, the lower parts of the trapezius below the level of T7 or the inferior scapular border. And then, of course, it helps give you some just anatomy, right? So
Lets them know that we know the anatomy.
exactly,
Yeah.
and honestly, that's really the awareness that he's looking that any of us would be looking for.
Sure.
I mean, I'll call you off.
Yeah, you'll
to be
cut us off.
honest. If you got it, you're demonstrating it. You got it. I don't. There's not much more. You should take a test in 8 minutes. Not 15.
Right, right.
If you got it, right.
Right.
Why waste any more time? You got to sit there and look at the clock. But for some, there's a process, and it's okay. That process is part of the learning. It gets faster, just like everything else. Then you might also consider, just doing a quick check of all of the transverse processes to feel for any sort of swelling and bogginess. You might even just sort of scan some of that paraspinal musculature again, just to make sure. That advances you into the motion palpation aspect, right? Because we're done with static palpation because all we really need to know is
What's there.
tissue do we
Yeah.
expect inflammation to be.
Right.
And at this point, you already kind of have some ideas, so now you're proving it with active range
I'm going to confirm some things, right? So if I had a global range of motion issue, I know this. All I know is that the thoracic spine's involved in a lack of movement. I don't know if it's muscle, ligaments, or neurologic or joint. And so I would go through all three ranges of motion, which would help me sort things out just a little bit more, because resisted will geek out the muscles. You resist somebody in extension, they go, ooh, that hurts. You say, where? And they go, it's right here.
Yeah.
That's not a facet. That's a muscle, right? So you're like, okay. Thank you. You're telling me exactly what I needed to know. And examination is honestly just you working with them. And it's unfortunate, but your job is to provoke the chief complaint. Sorry, I'm gonna make whatever you're complaining about hurt so that I know what we're dealing with here. And that's just pretty much the nature of it. Same thing. On bad days, you know, you're like, does that hurt?
They're like, please.
What's that? So in practice management, they'll coach you to do